on behalf of my colleagues who were involved in the JULIET study, we presented, number one, an update, 3-year update of the clinical study details, but also a new analysis which showed that expression of MYC in the tumor tissue as well as LDH can be used to predict outcome in patients who receive this kind of treatment. So what we showed in the clinical update with a 40 months median follow-up is that the progression-free survival at 36 months was 31%, and that these responses were stable, particularly among responders. So 60% of the responders maintained their response at 36 months. So those data show that even after 3 years, patients will have continuous responses. Then the analysis that we did in regard to predictive factors or prognostic factors was that we divided patients by their MYC expression on the tumor tissue sample into patients who had more than 40% expression and less than 40% expression. And those patients who had more than 40% expression had a poor outcome in terms of duration of remission, in terms of progression-free survival, and also their overall survival was worse than those of the patients with low MYC expression. Likewise, we showed that it's good to have tumor-infiltrating CD3 cells. So if you have high CD3 counts, you will do better. And if you have a higher percentage of particularly LAG3 CD3 T cells, then you do worse because obviously your microenvironment is not optimal for CAR T-cell treatment. And then we try to combine a clinical lab parameter like LDH with the MYC expression. And what we found is that we can separate out two groups. One group which is particularly good, those with negative MYC expression and normal LDH, with a stable probability of progression-free survival around 75%. And a poor group who had LDH higher than normal and MYC positive, and those patients performed much worse in the progression-free survival. So to conclude, stable data with the JULIET study long-term, and new predictors or possibility to create predictive scores for this type of CAR T-cell studies.